Welcome back, day 22 of the 27-day mobility challenge here at the Reprogram, and we are carrying on with these lower body prerequisites, these essential range of motions required to function effectively through day-to-day activities, physical training, whatever. Okay, this is the ideal amount of joint range of motion you need to function effectively. And of course, the reason is because these range of motions minimize your injury risk and they minimize the degree of damage. They can be the difference between a muscle strain and a complete tear. Okay, so today we're moving on to abduction, testing the adductor length, these medial muscles on the medial thigh, testing whether we can actually get that abduction length necessary and that abduction function, if you like, the movements, the positions necessary so that our hips can clear that joint space. Should we be utilizing like the frontal plane, moving side to side, a very common movement in sports, and also not having this range of motion is a key component of patellofemoral pain. We obviously get that medial pull on the side and it offsets the tracking of the patella. We get groin strains, pains, weak abductors because we can't actually bring the leg out to the side, so the muscles on the lateral compartment of the hip get very weak and underused. And that also makes another reason why the iliotibial band gets super tight and overloads, kind of stays in over tension, if you like, and that can interfere with that iliotibial band syndrome. Not only that, but it also really messes with the hip joint itself, hip impingement, bursitis. Okay, without having that space for that hip ball to kind of roll up, it basically tight adductors basically pull it in, and it really grinds into the actual top, the anterior part of that socket, and we get pinching of the tissues from FAI, femoral acetabular impingement. Okay, and also with that comes the joint above. So we're also getting an interfere of lower back mechanics, SI joint issues. And you realize that with all these kind of joint restrictions, particularly in the hip, you're liable for a lot of the same injuries. This either a disturbance of the labrum, a disturbance of the tissues around the capsule, a disturbance of the tissues below, so the knee joint, and a disturbance of the tissues above, the lower back, or the sacroiliac. Okay, and so the test we're going to go to do today is, traditionally, it's called the supine straight leg abduction test. Okay, and we're going to do a modified version of that, which you're going to see in a minute, using the wall and the floor, which everyone has, so that's good. Now, there is a bit, I don't personally, the clinical version I don't like. I don't rate the test at all. It doesn't tell us anything. Now, traditionally what would happen is that you would lie on the physio bed and they basically, on your back, and they pull your leg out to the side. And that's how they test the abduction range of motion, right? So, but when you're passive, it doesn't tell us a lot about how you're utilizing that range of motion in a, I don't want to say functional, but a more realistic day-to-day way, okay? And what you'll realize is, as we go into the movement in a bit, the way I do it, or the way we do it at the Reprogram, actually adheres to more of that realistic method, that realistic movement capacity, if you like, and it gives us a more real-time, true measure of what's really going on, okay? And it allows you to feel it as well. Feel what's going on in the hip capsule, the muscles on the medial thigh. Okay, so without any further delay, let's get into it. All right, so this is the modified version of the supine straight leg abduction test. Now, as mentioned, traditionally, the physical therapists have you kind of lying on your back, like so, on your physiotherapist bed, and you basically pull the leg out in sort of passive abduction to test this range of motion here, right? But the bad thing about that test is, to me, is that it doesn't actually test the function of when, or the movement capacity of when we actually access that abduction angle. Now, not functionally, realistically, whenever we're like moving in the frontal plane, or we need to increase our leg stance and perform a squat, that includes hip flexion. So as always at the Reprogram, we like to go one better and evolve these tests to more of a realistic movement pattern to see where we're really lacking length in these adductors, the groin, why we're maybe getting knee pain on the medial side, and we have to include that hip flexion angle. Okay, so this is what the test looks like. You are going to get yourself up against a wall, like so, and you are simply going to roll back with your feet up against the wall like this, okay? Hands resting on the chest. Now we've got that, you notice we've now got a hip flexion angle. We've got that 90-degree angle, so we're really maximizing these tissues, and the hamstrings as well, but a bit more adductors. Now what you'll notice is I don't want you to point your toes or relax them, flex them in like so, and keep them pointing this way throughout the whole movement. So you're gonna lower yourself down, lower, 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 and then use your hands to do the rest. Okay, and as you'll see, I've kind of got like a 35, 40-degree angle off the floor. That would be a pass. Okay, that is a very adequate, ideal range of motion across bilateral abduction space. All right, and you'll feel the stretch on these muscles of the groin, the adductors really kicking in, and some of you might get some cramping in the hips because you haven't actually reached this end range of motion for a while, and that is a pass. All right. So a fail would be the obvious. You don't get down that far, the feet turn out, you really feel the stretch here, and some of you might even feel a pulling on the lower back because of that tightness in the hip that you have, okay? So that is the modified version of the supine straight leg abduction test. If you like what I'm doing and you like what you're hearing and you want to find out more and how I can help you, check out www.thereprogramonline.com. We'll see you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of The Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine a life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.